If you lost a tooth many years ago, you might have heard something like this. It's no longer possible to get an implant. The bone is already gone. But is that really true? I'm Dr. Alessandro Barbosa, a dental implant specialist with over 20 years of experience, and today I'm going to show you what modern dentistry can do in cases like these. Stay until the end, because I'm going to explain in which situations it's still possible to rebuild the bone and what really determines the success of an implant, even many years after losing the tooth. Let's start by understanding what happens when a tooth is lost. The bone that held the root loses its function, and the body understands that this bone no longer has a purpose, as if the bone were just extra. Gradually, it begins to be reabsorbed, and that's why the longer you wait, the less available bone there is. But time isn't the main factor. The main factor is each person's genetics. Some people lost teeth many years ago and have enough bone to place implants, while other people, even if they lost a tooth a short time ago, may not have enough bone for the implant placement. In fact, there are many factors that can play a role. Time, genetics, the way the tooth was lost. But the good news is that today there are advanced techniques available that can help to rebuild the lost bone with highly predictable and reliable results. And even better news, there are now very efficient and effective techniques to resolve most cases without the need for a bone graft. Techniques like using tilted implants, short implants, and even personalized implants, among others, mean that a graft is necessary less and less often. Technology has changed the game. With digital planning, we can visualize the bone in all its dimensions, avoiding surprises and optimizing the results. To know whether or not a graft is necessary, each case needs to be analyzed by a specialist. In some cases, a graft may be indicated for aesthetic reasons. So, if you lost a tooth a long time ago, know this. There's almost always a solution. With planning, technology, and experience, it's possible to recover function, your smile, and your self-esteem. Seek out a specialist with training in implantology and discover what modern dentistry can do for you today. If this video helped you, leave a like and share it with someone who needs to get an implant. It could be the first step to changing that person's life. And if you want to keep learning more about implantology and oral health, subscribe to the channel and activate the notification bell so you don't miss any new content. I'm Dr. Alessandro Barbosa, and my mission is to simplify dentistry and help you make decisions with confidence and information. See you in the next video.